I'm Courtney Loving. I have a master's in community counseling from Columbus State University, and currently I hold a license for associate professional counseling. So that's the license you get before you get your full LPC. My practice since graduating from the program has probably been fairly eclectic because I work for a United Way agency, so I see just about everything from children to couples to adults, dealing with all sorts of issues, whether they're relational or anxiety related, trauma related. So my practice so far has been fairly eclectic. I sought supervision because it's a requirement by the state to get licensed. You have so many hours that you need in order to, depending on the state you're in, at some point get your license. Now in Georgia, you need 3 years of work, supervised work, whereas in states like Idaho or Texas or Virginia, they have a totally different, regulation, so a requirement to get the license. But all states across the country require that a fledgling counselor get supervision. So, and really, after I do have my license, it's really important to kind of keep a supervisory relationship going, so that it kind of helps with checks and balances. You know what I mean? Dr. Long, how would I describe being supervised by Dr. Long? He's very direct, while remaining incredibly caring. So it's kind of an interesting, just combination, where that you're going to kind of get the loving care you need, and he's going to be respectful and mindful of your growth, your development, where you are in this process, and yet he's going to be very direct. I've seen him be direct with other people he's supervised, but he's also very direct with me, and somehow it always comes across where it doesn't hurt, it doesn't feel bad, but he does let you know where you have room for growth, and he also lets you know what you're doing right. So, I care about him very much as a supervisor, as a person, and I think in terms of modeling what it means to be a good counselor, he's fantastic. Because he sort of is the whole package. He lets me find who I am on my own, while providing a structure and a guidance that I need to explore safely who I want to be, who I have been, and who I'm going to become. So, I don't know, I think he's a pretty great supervisor. Sure. I mean, as a counselor, my focus is really attachment-oriented, relationship-oriented. So it's funny, earlier I said something about people coming in with relational issues. I think most of us have relational issues, whether they're with, an intimate partner or whether our children, whatever. So Dr. Long and I really align in that way. He really understands attachment theory, and he understands that relational piece. So it's been really nice to have somebody to dialogue who strives for something similar, who strives for what I strive for, which is understanding how we relate to others and how our different issues, whether they're anxiety or depression, kind of all get fed into how we relate and how we don't relate, how we create distance and how we create closeness. So he also helped guide me towards what I emotionally focused couples therapy. I don't know if it was something he saw in me or he just introduced me to it and I grabbed on, but so he has studied a lot in emotionally focused couples therapy, and consequently so have I. So, but his philosophy, my philosophy, is sort of open to to what we talked about in the beginning, which is an eclectic body of work, so that we could really work with anybody who needs help. I don't know. I can't think of a better mentor or a kinder friend than Dr. Long. So that might make me cry.